Good afternoon. We will begin momentarily. Thank you.
Thank you.
Ever been a bigger task than reopening Florida's economy?
Yeah, I mean, kind of had to face these things after 9/11. Remember, we spent a lot of time. The nation's airports were closed, locked down.
Yeah.
People were scared. They didn't know what was going on.
If the executive committee members could please put their phone on mute. Thank you.
Want to thank you all for your time and efforts, not only for being on this committee, but what you've been doing over the last couple months. It's been a really long road, very tiring. I know most of you have been working 7 days a week, and but I want to commend you because I think that the state of Florida has really answered the call and is doing quite well. Where do we stand right now? I think if you go back a month and a half, everyone was predicting, certainly in the media, that Florida's hospitals were going to be overwhelmed. You were going to have a massive disaster, and obviously patients wouldn't have got the care they needed for COVID and then other things. And that was almost the universal prediction that we saw from folks both in the media and expert class. Well, that hasn't happened. I think that because of Floridians stepping up to the plate, in fact, since February, the both regular beds and ICU beds, available beds, has actually increased in the state of Florida. So rather than overwhelming the hospitals because of a lot of decisions that you guys made who were in elective office locally, because of what hospitals have done, some of the things we did at the state level, we're not only not overwhelmed, we've got an enormous amount of capacity. In fact, if you look around and see how Florida stacks up to some of the other places throughout the country, if you look at current people hospitalized per 100,000 residents, New York is 87.2, New Jersey 86.9, Connecticut 54.4, Massachusetts 54.1, Florida is 9.8 per 100,000. And so, that is certainly no one predicted that we would be there, and I think that we're appreciative of all the hard work everyone's at. Current ICU per 100,000, New York is 25.8, New Jersey 22.8, Michigan 13.5, and Florida 3.5. So again, the capacity is there, the system is holding up, and I think people have done a great job. But that hospital capacity was the touchstone of flattening the curve. That's why and not just some of the things that government's done. I think those get overplayed in terms of their effectiveness. A lot of the voluntary social distancing that people did, everything from making sure that they take hygiene seriously, to avoiding crowds, to doing things to protect themselves and their families, all that, including what some of the government levels of government have done, was all to preserve this hospital capacity. And so that really, I think, is what we have to make sure we can continue to do going forward more than anything. And I've talked to folks around the state, and I think we clearly have a path to do that. But just keep in mind that is really what the number one reason that we embarked on this period in our history to do. Now, a lot of folks were saying, again, a month and a half ago, that Florida was going to be just like New York. And people said, actually, maybe worse than New York because we have a more vulnerable population. Well, that hasn't happened. In fact, New York has nearly 25 times as many fatalities as the state of Florida, even though we have 2 million more people. And so I think folks have understood, both at the state and local level, the hospitals, that we have vulnerable populations, but I think a lot has been done to be able to protect them. We did things early by limiting access to nursing homes and assisted living facilities, requiring all staff to be rigorously screened before they can go in.
This conference will now be recorded.
N95 masks, and we've now underway more recently, because the situation is if they followed those restrictions, a lot of times they did okay. When they didn't, they let a sick person in, there were problems. But then what happened was you started to see some asymptomatic staff members go in, and you'd have like 10, 20 staff members that could be infected. So we're doing spot testing with the National Guard, trying to identify any infections before symptoms arrive, and then be able to try to isolate that. And we've also been very clear about the risk that this poses to our elderly population and people with underlying conditions. I think if you look at Florida's fatality statistics, we are probably between 82 and 85% of the fatalities have been 65 and up. And that's a pretty consistent trend, I think, throughout the country. But that is just something that we know there's a vulnerability there with this virus. And so we wanted to make sure that we did that very early. As we go into this next phase, we're going to continue to do a lot of the things that we're doing for the vulnerable population. And in fact, we're already looking at ways that we can do even more to have a real targeted effort for those folks who are the most vulnerable to COVID-19. Many of you know, if you look around the state, that southeastern Florida, the three big counties, Dade, Broward, and Palm Beach, they compose about 60% of the infections and over 60% of the hospitalizations and fatalities. And so we've been working, obviously, very closely with the local officials in all three of those. I have all three county mayors that are on this executive committee. We really appreciate all the hard work you guys have done, because I know you've had some challenges. And, we believe that you've all made a lot of progress as well. But we also understand that the situation in those three counties is a little bit different than where it is throughout other parts of the state. So we want to work with you just as Floridians, but then also if there's local solutions that we need to work on, we're happy to do that here at the state level and work hand in hand with you. So I think the way forward, there's a number of things, but you're hearing a lot about the ability to test, and that's obviously very important. Diagnostic testing, of course, is someone has symptoms, they show up to work. Is there an easy way for them to go get tested so that we know whether they're COVID positive or not? And if they are, obviously they have to self-isolate. The county health departments would then figure out who they've had close contact with and potentially test and isolate some of those individuals. So you need to have this available. Now in Florida, we've done, I think, about 265,000 tests as we sit here today. In Southeast Florida, the ratio is even better than statewide. I think it's one test for every 60 folks in Southeast Florida. But going forward, I think people are going to want to see that there's testing available. Now, a lot of the hospitals have been doing it. They have their own labs. They can do a certain amount. We've worked with the White House to get more point-of-care tests into the hospital. So you have some of these things like from Abbott Labs that can do a 5-minute test spoke with the president about that today again and told him that we need to license more point-of-care manufacturers to be able to get those here, and he understands. I think he's going to send some more to the state of Florida, which we very much appreciate. So you do have hospitals using those. There's other tests that are 45-minute tests, the Cepheid test, which, again, in a hospital environment is a pretty quick answer if you have a healthcare worker or somebody that comes in, which is very, very good. And so that part of it, I think, has gotten so much better just in the last month and a half. I think what we're now going to have to do is say, okay, we understand if someone is symptomatic, they got to have a place to go. Maybe that's their doctor's office. Maybe it's at one of the test sites that we have. I think we're going to keep running a lot of these drive-in sites because they've been popular and they're easy to access. And we're also working with some of these big labs that can potentially do more high throughput. We just had a call with the vice president of the task force today. There's a concerted effort from the federal government to get as many of these high throughput machines online. And to that end, they increased the amount of money that per test from $50 to $100. That has gotten people off the sidelines because it's economical for them to do it. So the Department of Health here, Department of Emergency Management, we're working on figuring out what the best way forward is so that we can do a lot of tests and get results quickly. Because if you have somebody that's in a business and they get tested and you get results in 6 days, that's not efficient or effective. What you want is if somebody has symptomatic, they test. Obviously, you'd want an instant result if you can, but if you're doing the PCR test through the lab, if you can get it within 24 hours, then a person's negative, then they know that they have something else other than coronavirus. And if they're positive, then you immediately do the contact tracing and try to contain it. So we're hoping to be able to have a lot of options in that regard going forward. The other testing, though, that we're going to start doing is antibody testing, the serological test. You're starting to see this in different places, and I think actually some of our universities here are starting to do stuff with it. But it's basically those tests determine whether you have antibodies in your blood, which if you do for this, then that means that you had the virus at some point. And so they did this. Stanford University did this out in Santa Clara, California, and Santa Clara had X number of positive test results in their county. They did random sampling for the antibodies in the county, and the researchers determined that between 50 and 80 times more people in the county had the antibodies than have actually tested positive for COVID-19. So that has a lot of implications to know what is the actual denominator in this thing, how many people have actually been exposed to it, and if those Stanford numbers are right, I think what that means is probably the majority of people that have had it don't even know they have it or have symptoms that are so mild that they wouldn't think to go in and get medical care. Now, that's just one study. I think it tracks with some of the stuff we're seeing. You see they just randomly sampled a bunch of people in like a homeless shelter in Boston. A bunch of people tested positive or had the antibodies, however they did some of these things. So I think it seems like the evidence is pretty clear that there's a much broader group of people that have had this thing than what our test results were actually show. How much more? I think you're going to need more, but we're going to be doing that. And so someone has the antibodies. I think the thought is that they're immune. Like the World Health Organization says not so fast. But, they also said this wasn't contagious person to person in January. And so I don't know that they've been right on a lot of these things. I think most people think that you would be immune or at least have some level of immunity. So we're going to start doing that. But what it also will show is if you have a huge amount of people, particularly that under 50 cohort, that have had this compared to have tested positive, that means the hospitalization rates and the lethality rates drop dramatically if you have a much bigger denominator. So that will give us a good sense of exactly how this thing is circulated and exactly which folks, are most likely to go to the hospital. I mean, we kind of know, obviously, already, but how broad was it throughout kind of the general working age population? So those are going to be the two main components of the testing. And then, obviously, we need to get the economy back in a safe way. Part of that, I think, is having the testing. I think it's going to give people confidence that they're going to be able to participate in the economy. But I think that it's important for businesses to start thinking about and have a plan as soon as possible. What would this look like when we go back? And I think some of them have some really good ideas. I was talking to a company today where they're going to say, May is going to be optional for some of their employees. If they're not comfortable coming in, that's fine. They're going to break up the workforce into different shifts, to try to reduce density in the workplace, and then they are going to continue doing telework for the people that are able to do it. I think one of the things that has come out of this is companies are going to realize some of the business travel they've been having people do really isn't all that essential. So you're probably going to see less, not just from a health perspective, but from an economic perspective. You're going to have restaurants, you're going to have hospitality, you're going to have all these things where how do you approach this in a way that is obviously going to be safe, but I think even just as important is the confidence of the public. I mean, you had a lot of stuff being said in March about, just about this virus, which is a serious pathogen, but I think it was really where people were legitimately just frightened to the dickens. And so if you start having restaurants, even on a limited basis, how much confidence are people going to have, that that's safe, or some of the other things that we used to take for granted? And the way I view it is some of these other states have done a lot of ham-fisted restrictions. Like if you walk in your driveway, you'll get harassed. You can't plant a flower, things like that. And I think all that's counterproductive. I mean, what we're trying to do is this is a virus that is generally transmitted when you're in close contact with someone, usually for a repeated amount of time and usually in an enclosed environment. Doesn't mean, you can't just catch it on a whim if you just happen to be in the right place. But most of the transmissions are going to be in that type. So how do you run a business where you're minimizing the close contacts between employees or between an employee and a customer? How do you do it in ways where the environment is less conducive to transmitting this thing? I think there's a whole lot of ideas out there, and I think obviously you guys will be a part of getting us in a good direction to be able to go forward. So I just want to say thank you for doing this. This is going to be really, really important for the state of Florida. I mean, we were chugging along very well. You look at places like Miami, it was like you couldn't even drive a block without seeing a crane somewhere. I mean, we were really on fire in many respects. This is obviously a roadblock for the whole country, but I think if we bounce back in a very thoughtful, safe, and efficient way, that I think we can minimize or at least mitigate some of the damage that's been done and hopefully have a path back where Florida can be the place that people are looking to for leadership in terms of that's the way it's done. And that's going to be a function of leaders like you continuing to be in there, nose to the grindstone, and stepping up like you've always have. So my personal thank you for all you're doing. I think we're going to turn it over to the Florida Chamber of Commerce, who's going to talk a little bit about the economy. Then we have Director Moskowitz talking about the just enormous logistical operation that we've undertaken here in the state of Florida. We're going to hear from our Surgeon General, Scott Rivkees, about the case and health information. We'll hear from Secretary Mayhew about provider capacity and resources. And then we're going to have our Chief of Staff, Shane Strum, talk about the working groups and the calendar for the meetings ahead. But what we want to do is, let's get these ideas on the table as soon as we can. Let's chew over this and let's develop a way, the best way forward. And with that, I will turn it over to the Chamber.
All right, Governor, thank you very much. This is Mark Wilson, and Governor, thank you very much. I'm honored to participate, and I think I speak for all 22 million Floridians, and certainly for the business community when I say that we thank you, Governor, for your leadership. And as you've said, these are obviously unprecedented times, and again, from all of us at the Florida Chamber, we're very grateful for you and for your team, and especially that you, from day one, and you continue to be grounded in the facts or in the data, so to speak. So my chief economist and I, again, we appreciate being asked to provide what we hope is some context for the work of the task force. And to the task force members throughout Florida, I hope you will please consider that the whole world is watching us. They're watching Florida, and they're looking for your recommendations. And my hope as president of the Chamber is that other states and, in fact, other nations will point to the work that you're going to do to Florida's restart as not only a national model, but as a global model. So as we think about reopening Florida, again, we're gonna just give a quick context on where Florida was, where Florida is in terms of our economy, what makes up our economy, what's at risk, and how would we suggest the task force go about thinking about the different pieces and parts of the economy. And so I'll cover the first part of this, and then Dr. Jerry Parrish, the chief economist for the Florida Chamber Foundation, will then go through some of the data on the economics, and then, time permitting, we'll be happy to take any questions. So the governor was right. Florida was on pace for a record year, and I think what we all know now is, we were on pace for one kind of a record year, and we're probably going to end up with it being another kind of a record year. And so as we think about Florida at a glance, remember, we had our first confirmed case of COVID 49 days ago, back on March 2nd. So I want to give some context to what Florida's economy looked like around then, because as you navigate how we restart our economy, again, the governor has continued to talk about using data and modeling and facts. As you think about restarting, we eventually need to recover back to where we were, and I want to give context for that. So I think everybody knows we're the third largest state in America. We typically grow by about 900 new people every day, 7 days a week. And to give some flavor to that, that's 810, 90% of our 900 new residents a day come from another nation or from another state. So 90% of our growth on a daily basis comes from outside Florida, another state or another nation. In terms of job creation, under Governor DeSantis' leadership, Florida was creating 1 out of every 11 new U.S. jobs. We've been doing that for a number of years now. In terms of visitors to Florida, last year we welcomed more than 127 million visitors to Florida. More than 14 million of those were from other countries. So think about the importance of tourism to Florida. In terms of our GDP, at 1.11 trillion, if Florida was a nation, we would be the world's 17th largest economy. And our goal by 2030 is to be the 10th largest economy. And we hope you'll keep that in mind as you think about your recommendations. In terms of income migration, we've heard a lot about people leaving New York and the Northeast and other states, so their high tax, high regulation environment. We're adding about $1.19 million of income every hour of every day, 24 hours a day, 7 days a week, 365 days a year. In terms of unemployment numbers, it seems hard to imagine given the national news right now, but back then when this started, we had a 2.8% unemployment rate. We had about 291,000 people unemployed, but we had 340,800 open jobs that were unfilled. Just think about that. That's just a few months ago. And in terms of industry diversification, this is something that not a lot of people know, but I really hope you'll use it as the task forces move forward. Again, we're the 20th most diversified state economy in the entire country, and we have a goal of being the 12th by 2030. Thinking about economic diversification, we've provided a slide for you from the FloridaScorecard.org that, again, shows that we're the 20th most diversified economy, but you can see on the slide the breakdown by MSA. We have 22 MSAs, and as you do your work, keep in mind the importance of rural Florida, and keep in mind that, we have 67 counties. They're not all the same. In terms of reopening Florida, I really want to encourage you as task force members to think about what the governor was saying in his opening remarks, that, we have a big state with 22 million people, but Florida is unlike any other state in the country, and we have at least 4 areas that you need to take a close look at. We're going to have a very surgical reopening to Florida. So, for example, when it comes to tax receipts, approximately 20% of our tax receipts come from tourism. In terms of general revenue from sales and use tax, about 79% of our general revenue in Florida comes from sales and use tax. In terms of our population, about 21% of our population is age 65 and older, and we know that that matters in a COVID environment. And then, of course, we have hurricane season coming June 1, and I encourage you to be very mindful of what that means on a going forward basis. So let me just say a word about our GDP. I mentioned if we were a nation, our state would be the 17th largest economy in the world. But let's talk about what makes that up. We've provided you in your slide deck a GDP and jobs share by sector. And what you can see there is, real estate, if you look at it by industry, real estate, it generates about 17% of our state GDP, but only generates 2% of all of the jobs. If you look at healthcare, for example, you'll see that we're 8 or 9% of GDP, and then you can see 13% of jobs. If you look at tourism, for example, we have about 4% of GDP, and yet it's 11% of jobs. So we don't have time to go through all of those, but you can see how the logic works on that deck, and we're more than happy to get more info for you. In terms of the jobs that are at risk, and I want to explain what you're looking at here, because when most people see a graph and you hear that jobs are at risk, normally we think about it being because of a recession. What you're looking at here has nothing to do with a recession, but it has everything to do with an analysis that has been done that takes a look at all 800 occupations. And the analysis was performed by, thinking about social distancing. If you look at if these jobs can be performed in close proximity to other employees or to the public, then what you can see here is the total number of jobs that are vulnerable on a going forward basis. And so that, that's going to be very, very important as you look at going forward on that. Also, what I'd like to do is, at this point in time, what I'd really like to do is I'd like to turn the program over to our chief economist. Dr. Jerry Parrish has taken a look at what all of this means on a go-forward basis. And then again, we're going to have some time for some Q&A when we come back. One other slide that I gave you, in fact, I'll go ahead and mention this. I think it'll give context to Dr. Jerry Parrish's overview. One other slide I gave you is the impact not only on the types of industries that we have, the sectors in Florida, but also by the number of employees. And if you look at that slide, you'll notice there's, in all the industry sectors, there's also 3 shades of blue there. And what you'll notice is that there's 3.4 million jobs in Florida that are at risk. And that's out of just over 10 million jobs in Florida. But I would encourage you, task force members, as you look at the different industries in Florida, also please pay attention to the size of the business and how it's going to be impacted by this as well. So in the employees that are in the companies with employees under 100, 36% of those 3.4 million jobs are at risk. If you look at the number of jobs between 100 and 499 companies that work, or jobs that are in those companies, about 12% of the jobs are at risk. And then if you look at the jobs out of the 3.4 million jobs that are at risk in Florida, about 52% of those jobs are from larger companies with more than 500 employees. So as you do your work and you look at this geographically, as you use the data, as you look at industry sectors where our GDP comes from and where our jobs come from, again, this is going to have to be very surgical, and we wanted to provide you some background on what you're looking at there. I'm going to now turn it over to the Florida Chamber Foundation's Chief Economist, Dr. Jerry Parrish. Jerry?
Thanks, Mark, and thanks for letting me be on this call. I want to talk about a couple of things. One is the forecast going forward, and I want to give a little more detail about some of the things Mark was talking about. As an economist, I look at this. This is an unprecedented event. The suddenness this thing came on, nobody anywhere in the world was forecasting this when we were all doing our forecast for 2020. So what I want to show you, I've got a slide that shows a couple of forecast scenarios up there. I want to be really clear about these two forecasts. One of them has time to return to the pre-crisis numbers. We're already there at the fourth quarter of this year. It shows pretty steep drop in second quarter, growth in the third quarter, and back up where we were before by the end of the fourth quarter this year. The other one is a much more pessimistic scenario. I want you to think about both of these as bookends. There are tons and tons of forecasts in between these two, but these are kind of the far, the optimistic versus the very pessimistic. Very pessimistic could come in when, there's really poor control of the disease, there's no vaccine, it could drag on for many, many quarters, but certainly most of the forecasts out there put a recovery in at least, sometimes in the third, but at least by the fourth quarter is what I see out there. When you look at that risk by sector, we've got it on the next slide according to different industries. Now, I want to talk to you a couple things about this. The low risk is just over a third of the jobs in the GDP. The medium risk, about one job in every 5, it's around 20%. But the higher risk, and this, remember, is the risk not of losing a job because of recession, but losing a job because you have close contact with coworkers and close contact with the public. Those are just under 4 in 10. A couple of the categories I want to show you there. One of them especially is construction. It's really hard to lump these industries into just one or the other. I think construction is a really good example of this, because you could have very close quarters construction where cabinet makers are working together to install cabinets in a house, versus road construction, to where you're really not around a lot of people in very close contact. So keep in mind that certainly things like that you can put in multiple categories, where a lot of those jobs in there don't have a high risk, but some of them do, and it depends on the sector they're in. The next slide adds a little color to that. It adds the number of small and medium firms in these three risk profiles, and it talks about the total employment, the number of jobs in firms of different size. And what you can see there is a couple of things. One is the number of jobs in large companies is a large number. It's a high percentage of them. But even though the number of jobs in smaller firms, the percent is not as high, it's going to be much more difficult if those small firms to come back than it would be some of the larger firms. The next slide I shows the sectors mapped on the size of the sector. It's a dot plot. What it shows you is the amount of GDP, percentage of Florida's GDP that are generated by those industries, and the jobs at risk on the X line down there at the bottom. You see a couple things here. One, healthcare is a great example. High GDP, and actually lower risk than some of the other industries out here overall. And you can see, we know some of those jobs are going to come back that we've lost, like dentist office will reopen, those kind of things. Take a look at manufacturing in there. That's a real high GDP industry, but only medium risk. And we know different manufacturers are using different techniques to keep their employees safe, to keep in business, and certainly that's a big issue. One of the things I do want to talk about, Mark mentioned this, you got to think about our rural counties in Florida. They're going to have a more difficult time coming back. There's no doubt about that. Also want you to think about something that we work on here at the Florida Chamber Foundation with our prosperity movement. There's more than 870,000 kids in poverty in the state of Florida, and those lower income households, are going to have a more difficult time. The probability they'll be in some of these jobs that are high contact is higher, and therefore the job loss is certainly going to affect them. And as an economist, I think about all the folks in Florida, the rural people, the people who are lower income. And so, I hope the task force will take those groups into account as well. The next slide is just a detailed data by sector. We put this together just so the task force could use it. The charts and things that we've shown, this is where the data comes from. It's all in one place for you to be able to look at those different industries, the number of jobs at risk, what the profile is, large companies, small companies, when you're making your decisions on how to open up. The last slide I'll show is tax receipts. These are sales tax receipts by industry. This is done on calendar year. I took the calendar year 2018 and 2019 and just averaged the two here. And that's where that percentage comes from and the number. This is ranked 1 through 22, and this covers 84.4% of Florida's sales tax. You can see there at the top, automotive dealers, $4 billion a year. That's 14.4% of Florida's sales tax receipts over the last couple of years. Other things you can see down there, general merchandise, all the way down through manufacturing's down there at number 11. You can see where the other ones are to give you more ideas as well of what kind of impact and what kind of tax impact they're going to have. So the last slide in the deck is contact information for me and Mark. Mark Wilson is working about 24 hours a day, and a lot of us are at the Florida Chamber Foundation. If you want more info or more clarification on this, there's our email addresses. Please feel free to contact us, and we'll do our best to answer your questions. I want to turn it back over to y'all. Thanks very much, and Mark and I will stand by in case there's any questions. Thank you.
I want to do a special thanks for the Florida Chamber of Commerce for their time in helping us assemble and put everything together. So a special thank you to CEO Mark Wilson and their chief economist, Dr. Parrish. So thank you, everyone. What we're going to do at this time is we're going to open the mic in case there are a handful of questions from our executive committee members. If you'd like to chime in, just star in, and we'll answer your questions.
Shane, this is Alex Sanchez. Can I make a comment?
Absolutely. How are you, Alex?
Good, Shane. Thank you. How are you? I want to thank the governor for his leadership for our state. It has been vital here in these last 2 months, and I know Floridians from every corner of Florida really appreciate it. I want you to know that our bankers, Shane, are working around the clock processing these Paycheck Protection Program loans, and Florida ranked 4th in the country with the amount of loans approved at about $18 billion, and we were 3rd in the nation in approved loans. So we're going to continue that in round 2 this week to help you and the governor to help our state recover from this COVID-19 pandemic. And again, thank you very much to the governor, Shane, and to you and the team for everything you all are doing.
All right, thanks, Alex. And for those listening, Alex is the president of the Florida Bankers Association. Alex Sanders, thank you. Are there other questions, thoughts, comments?
Hey, Shane, this is Pat Summers from Lockheed Martin.
Welcome, Pat.
Yes, I just want to make a comment, and again, compliments to the governor and the staff, because we have facilities all over the country, as you can imagine. And I am the executive for Florida, and I think that the state has shown its leadership and stepping out in front of a lot of people. So just a compliment on being proactive rather than reactive, and all of us businesses appreciate that. Thank you.
All right, fantastic. Thank you, Pat.
This is Mayor Dale Holness, Broward County. Let me also echo my gratitude to the governor, to you, and everyone that's worked to get us where we are. I have a question, but first let me say that part of what we're going to have to overcome is the psychology of fear that so many people have about this virus. It's real indeed, but I think that if we can get widespread testing for those antibodies that are in our system and make it available so that folks can go out and get that testing if they choose to, even if it's at their cost, that might be able to help us overcome some of that fear that people have. So I'd like to know, Governor, how soon will we have this out? How widespread will it be? available for the community.
Okay. So, first of all, Mayor, thanks for all your hard work. You guys had so much to deal with. You have cruise ships coming in, people coming from and you guys have worked great, and we really appreciate the teamwork. So we've ordered, how many have we ordered? So we have 100,000 that are supposed to be delivered today, not this week, right? So, as you guys know, a lot of this stuff, and we need to change this as a country, is manufactured in China. So we have 100,000 tests that are due to the state of Florida from the company manufactures them in China, FDA approved tests, that hopefully will be here this week. I think what we would want to do is be thoughtful about it and do some random sampling so that we can then extrapolate. So in Broward County, you find a couple thousand people that would be representative of the community, and then you could project, okay, X number of people probably have the antibodies. And so it's a big priority for us. I'm hoping we get it this week. We've been, we placed the order as soon as it was FDA approved. And we want to continue. And I told Jared and the Surgeon General, order more as they become available, because I think you're right. It's important, and it is a psychological thing. If you look at that Stanford study, and if what they did is correct, and look, I think these guys are some of the best in the business there. But if their insights are correct, then you look at like people under 50, and if the denominator is like really, really big, then the fatality rate for folks under 50 would be like 0.0 something. It wouldn't even be 0.1 most likely, based on the figures we see in Florida, California, other places. And so if people see that, then I think that they can apprise. And I think you're right. It's a serious pathogen. I think all of us believe that from January when this thing started circulating outside of China. But at the same time, I'm confident that if we do it right, particularly those people without health conditions under a certain age, I think that they're going to be able to do fine. And once people get around to that, that's going to make a big difference. But what we can do with the testing, both diagnostics, serological, and other things, that's going to be the foundation to bring the confidence back.
Certainly. And also,
then we have the Surgeon General wants to pipe in on it too.
Yeah, so one of the things that we're actually doing is we're actually working with one of the groups that screens the blood supply in Florida, so we should be able to get a snapshot of everybody most people are donating blood across the state of Florida, so we'll look at this month over month for 2 months. I do want to caution that there are tests out there that are not accurate. 1/3 of all colds are caused by coronaviruses, and there are these different products out there. So if you are using them, we need to make sure that they are accurate and will give meaningful information. Thank you.
Now,
other questions?
Shane, this is John Porras. I want to echo what others have said. I think the governor has taken a measured and thoughtful approach to the response of COVID-19, and it's greatly appreciated. I know that, from a personal perspective, we've been on the phone a lot. He's very engaged in all aspects of this, and it's greatly appreciated. His leadership has been excellent. Question that I have is on the testing, just to follow up on what was just discussed. If we need to be careful, which I agree on what testing we use, should we at some point consider putting out a standard that says this is what you should be doing if you're going to be doing this type of testing? Because you're right, there are some systems out there that aren't as accurate as others. So is that something that we should at least just put on the list to consider as we proliferate testing across the state?
Well, thanks, John. So I think what the Surgeon General said is very, very important. So the antibody test we did is FDA approved to specifically identify COVID-19 antibodies. There are other coronaviruses that if you have one that is just trying to find any coronavirus, you will get false positives vis-a-vis the COVID-19. So that's very, very important. On these PCR-based tests, I think those have proven to be accurate. We obviously the lab capacity, as I mentioned, is important. we're looking not only to have contracts with some private labs with high throughput machines, we're also probably going to stand up a fourth state lab and outfit it with a bigger capacity. You know, we have 3 state labs, but they can only do so many samples a day, and that obviously limits us. So we're going to try to do it bigger, have it probably in the interior of the state that would withstand a hurricane a little bit better, and hopefully have one of these machines in place. They're working on it right now. Obviously, it would take some time to build all this out, so it's not something that's going to happen overnight. Now, on some of these other tests that are online, like the Cepheid or the Abbott, I think that you know, a lot of people are excited about it, and we don't know for sure, but I think the Surgeon General, some other folks have looked, and there's been some problems with how those have been administered and with some false negatives or false positives. So I think we're going to learn more about that as the days go on, but that's just something also to think about. The president's real high on it. He has an Abbott machine in the White House. If you go to anything in the White House, you got to get the Abbott 5 minute test. In fact, he volunteered to send one to the governor's office here. So anyone that comes into our office is going to now need to get it. We'll see what happens on that. But anyway, but the point is just, I would just, you know, keep looking to see kind of which tests have been, are having problems or not. There's a saliva test now that I think is getting emergency approval, or maybe did by FDA with Rutgers. And again, that holds some promise, and I'm not saying there's anything wrong with it, but I just think clearly convenience is important. We want as much convenience as possible, but the last thing we want to do is do a false negative, send somebody out into the world and have them spread this thing around. You know, because I'm talking to like hotel owners and stuff, and they want to test people coming in. They want to be able to have access to it. But but their biggest fear is doing a false negative. They do a false negative. People think it's safe. Someone goes in, you have a super spreader. All of a sudden, 10, 15 people get infected and get sick. That's not good, obviously, for health. It's also not good for business confidence. All right, so let's let Jared Moskowitz go. I know we got to go. Got a lot of great updates and is doing a hell of a job for us.
Governor, thank you. I want to thank you for your continued leadership and creating this task force. I want to thank all of the executive committee members for donating their time. I also want to thank all the first responders, the emergency management personnel, the healthcare workers, and law enforcement across the state. And really, we also should be thankful to the folks at HHS and FEMA who have been wonderful federal partners. The state of Florida has gotten has gotten their fair share of those supplies, and that's due to the relationship that the governor has up in Washington, D.C. So this disaster is obviously very unique. I know many of you know that. This is the first time in U.S. history that all 50 states are under the same disaster declaration. The governor has sent a letter to the president asking for 100% reimbursement, and that's obviously extremely important. So we're waiting to see what the White House decides to do with that, not just for the state of Florida, but many other states. Everything that we have done and that we have ordered and purchased is reimbursable 75% under the FEMA grant. That's how it starts off. We're very familiar with that here in Florida because of hurricanes. There's also an HHS grant that was created that is 100% reimbursable. There is no local cost share, and so we'll be trying to take what may be applicable under that grant and trying to apply for that money first, and then using FEMA at the 75% level as a secondary opportunity to get reimbursement. So this is the biggest logistics mission the state has ever run. Just to give you an idea, after Michael, within a 90-day period, we had 7,500 mission requests. In 30 days after this event, we've had 15,000 mission requests. We've been running the warehouse in Orlando, 200,000 square feet with the National Guard, 24 hours a day. We've been moving product around the state by 18-wheeler, by van, by box truck, and even by chartered aircraft, medical supplies, so that way our testing centers can stay open, and a lot of hospitals that were running low on materials could get that on an immediate basis. Over the next 48 hours, the division is going to be making a major push to the long-term care facilities. We're going to be sending out 5 million masks, 200,000 face shields, 500,000 gloves to long-term care facilities. That takes our total push to long-term care facilities to 7 million masks, 1 million gloves, over 500,000 face shields, and 160,000 gowns. And then to date, including all the hospitals and our first responders, we've sent out 12 million masks, 6 million gloves, 800,000 face shields, 650,000 shoe covers, 330,000 gowns, 150,000 containers of hand sanitizer, 50,000 goggles, 28,000 coveralls, and 18,000 Tyvek suits. And so we are continuing to run this mission. Obviously, we're going to run this obviously through May, and as we start to transition, trying to get a lot of more of the locals get their orders filled as we see the supply chain open. So hopefully we can reduce the amount that we have to send out, but we'll continue to fill gaps to make sure that we don't run into any health safety issues. I want to thank for a moment some of the private businesses that donated product, went out, found it themselves, and donated product to the Division of Emergency Management so that we could get that out to nursing homes and long-term care facilities and hospitals. And so Walgreens, Lowe's, Disney, Home Depot, Apple, Target, American Express all sent different commodities to the division. And so we're very thankful to them for being a good partner. And I want to thank all the other businesses out there who I'm not even aware of have been doing their fair share in their communities. There was a lot of focus early on hospital space, ICU beds, hospital beds, ventilators. We went out and procured 5,000 hospital beds. We got 450 nurses and doctors on standby contracts. And we actually added hospital space in this state. So the largest project was done with the Army Corps of Engineers. We built a 400-bed field hospital in the convention center, and an additional 50 ICU beds in that convention center. That was supposed to be opening on April 27th. The Corps finished early. That handoff actually happened yesterday, so we are now in control of the facility and are ready to operate it if that were to become necessary. We also have a 250-bed field hospital in Miami-Dade County, along with a 200-bed Pan American hospital, which we've brought back online, that is ready in Dade. In Broward, there's a 250-bed field hospital also ready to go. That's been open since April 10th. And then we have a number of other ones that are pre-positioned around the state in Palm Beach, Lee, and Duval County. First, we will continue with the plan that we'll surge into hospitals with the additional staff that we have gotten so that we can maximize, obviously, the hospital space that they have and their surge plans before we have to use any of these facilities. Testing. We continue to support the 8 largest testing sites in the state. That's the Hard Rock Stadium, the South Dade Government Center, the Marlin Stadium, the Orange County Convention Center, the Jacksonville Jaguar Stadium, C.B. Smith Park in Broward County, and the 15 ballpark in Palm Beach County, and Raymond James also in Tampa. And so we took 3 of those sites over from the federal government, and we have expanded testing. We have gotten rid of the age requirements, and we even got rid of the caps that the federal government had originally put on these sites, is how many people you can test a day, so that we can maximize testing in the state. It's why we're third in the nation in testing, and we're continuing to ramp up testing in all different areas. Lately, we're focused on ramping up testing in underserved communities. So we opened up 2 of those facilities in Broward, and we're looking forward to opening up in Palm Beach, in Dade, in Hillsborough, in Leon, in Orange, and in Duval counties in the coming days. And so we're going to continue to procure testing swabs and collection kits to make sure that we have the resources to expand testing as well as lab capacity. On nursing homes, the governor has focused since day one on protecting our vulnerable populations. It's why we were one of the earliest states in the nation to put in guidelines for the nursing homes and then close them to visitors, as well as having screening for the folks that work there, screening for all of the vendors. We've, as you heard earlier, had a massive push of PPE to these long-term care facilities, but sometimes no matter what you do, no matter how airtight we try to make things, unfortunately the virus still finds a way in. It's why we've requested 15 federal strike teams from the federal government. They're sending us 90 individuals, which will help us replace staff on a long-term basis as some of staff members have to take time off and isolate, or if they get sick. Currently, the division is supplying 53 nurses under contracts in long-term care facilities to help supplement staff. Hurricane season. We've been actively planning around hurricane season with COVID-19 since the very week we got activated here in Tallahassee. I took an entire planning cell, took them out of the EOC, and had them basically focus just on hurricanes. And so we are looking, and we'll be developing a plan. We'll be communicating with our emergency managers around in every county to get their input. But we're looking at things like shelters, doing non-congregate shelters versus mass shelters, getting away from schools potentially, looking at different evacuation plans, looking at, when your house was built, whether you should stay at home rather than evacuate. We're looking at, obviously, where you might be coming from, where you might be going to. And so these are all the things that we're looking at, and we'll have more guidance on that coming forward. Under the governor's direction, we pushed more recovery dollars down to the locals because obviously we know that financial resources have been constrained. So since March 15th, we've distributed $369 million across the state. It's the most amount of money the division has ever done in a 35-day period. And so we'll continue to work with our local governments and our hospitals to make sure that they get those remaining Irma dollars and Michael dollars as they get into hurricane season. Some suggestions for the executive committee in their deliberations. Obviously, at the division, we've always focused on models, hurricane models. A lot of attention's been paid towards the IHME model, which, since the beginning, first said our peak was going to be April 26th. Then it changed to, May 4th actually was the original prediction. Then it changed to April 21st, then April 26th, and then it says now our peak was April 2nd. So the governor has been extremely data focused. We look at the data every single solitary day. And I would recommend that you do the same thing and not just get totally focused on that particular model just because it's just not shown as reliability for the state. I think it's a good thing for suggestions also to talk to businesses about having their own hurricane plans, what to do with their employees, making sure their employees have PPE if that becomes necessary, so that after we potentially evacuate, they don't have to come back and have a self-isolation plan for 2 weeks and we get back into the same mode that we're in now. Additionally, as you guys are considering recommendations, please consider the PPE supply chain. Obviously, we all know that PPE is limited around the country, and so as you consider bringing things on a staggered basis, consider obviously what the supply chain can be like on what you may mandate or what you may recommend to the governor. Obviously, bringing on businesses in Suwannee County doesn't have the same sort of strain on PPE as it would in a Dade County or a Broward County. And so, these are the things that at the division we want you to consider as you come up with your recommendations. And so I want to thank the governor again for creating the task force, and I want to thank all the heroes in every community, all the first responders, the nurses, again, the law enforcement agents, all the hospital staff, and I want to thank all of you for donating your time on this committee, and I'll turn it back over to Shane.
All right, thank you, Jared. All right, a great update from the Director of Emergency Management. We're now going to turn it over to the Surgeon General, Dr. Scott Rizkes, with the Department of Health. Dr. Rizkes?
All right, thank you, everybody, for joining this important task. Also want to thank the governor for his incredible leadership and the lieutenant governor as well. Also want to give a special shout out and thanks to our fellow agency heads because this response has involved every agency states. And also at the onset, I really want to say that all of our thoughts are with those and their families affected by COVID-19 and those who have lost their life to this virus. So as we know, COVID-19, this is a new virus which appeared on the scene at the end of December. This is a virus that attacks the lungs. We continue to learn daily about how this virus behaves. As the governor mentioned, we are continuing to define how infectious it is and what the mortality rate is. We're in a situation where we still do not have a vaccine and we have very limited therapeutics. So most of our care is supportive and preventative. COVID-19 typically presents with fever, cough, fatigue, and shortness of breath. Occasionally, individuals can have a sore throat and a runny nose. Sometimes we can have gastrointestinal symptoms as well. One of the things that all gives us pause is the realization that there can be many individuals, or some individuals who are younger, who can be asymptomatic and spread this virus. As we're aware, this is transmitted by respiratory route. It can be transmitted by breathing, coughing, sneezing. And typically, the distance that water droplets spread after being breathed out is about 3 feet. We're now learning that this virus can be quite infectious 2 days before symptoms actually occur. And this is why CDC has talked about individuals wearing masks. The average incubation period is about 6 days. The outside period is up to 14 days. This is why if an individual has been exposed to COVID and are at risk for contracting the virus, we will have them isolate for 14 days. As the governor mentioned, this virus is especially harsh on the elderly and those with underlying medical conditions. As the governor mentioned, more than 80% of individuals who have passed away from COVID older than 65 years of age. Individuals with underlying medical conditions can also have difficulties with this virus. This includes people with heart disease, asthma, diabetes mellitus, immune disorders, and those undergoing cancer treatment. We have been preparing for COVID-19 since we first learned about this virus in early January, and the response really is massive, involving thousands of partners across the state. We are continually enhancing our partnerships using data-driven approaches to guide our action. We should also be grateful for the fact that the state of Florida has an integrated county health department system of 67 county health departments, and we work with partners on an ongoing basis. There's no question that the system has facilitated our response both locally and at the state level. In terms of our plan, we have had a 5-step plan from the beginning to fight COVID. 1, social distancing. 2, testing and contact tracing. 3, elderly and vulnerable population protection. 4, preparing hospitals for the surge and protecting healthcare workers. And 5, stopping the introduction of COVID into our state, into residential facilities. As far as social distancing, we all need to remember that the best way to avoid COVID is to avoid groups. Per CDC, groups should be limited to 10 or fewer, with 6 foot spacing among individuals. Individuals should not work when sick. We should screen workers for illness. We have been recommending that avoidance of individuals who are sick. We have recommended cover your cough, hand washing, and we have also recommended that those individuals with underlying medical problems or those in the elderly should avoid public places. We have also been focusing on testing, as the director mentioned, and contact tracing. To date, more than 260,000 individuals have been tested. We've had drive-through testing, community-based testing, testing at local health centers, and as mentioned by the governor, PCR currently is the gold standard. Also, quite importantly, if we identify a person who is COVID-19, we will contact that person, first making sure, see if they need medical attention, and then identifying their contacts. And their contacts will be asked to isolate for 14 days. This way, we can stop the person-to-person transmission. We have also been focusing on the elderly and vulnerable population, which I know Secretary Mayhew will also comment on. Early on, we restricted visitors to facilities. We instituted worker screening, recommended following best practices for sanitation and hygiene. We had workers wearing masks in the event that an individual is an asymptomatic carrier, so they would not spread it. We've had sentinel testing of workers, including a new program involving the National Guard. We have supported facilities in training and the use of personal protective equipment. And as Director mentioned, we also are having teams coming down from HHS to help in this regard. In terms of preparing hospitals, again, this started back in January, where we ended up having the hospitals prepare surge plans, included enhancing intensive care staffing and capabilities. And as far as stopping the introduction into the state, we are proactive in this area, looking at travelers coming from countries, parts of the U.S. where there's widespread community transmission, and having those individuals isolate for 14 days. And we're also working on limiting the introduction of this into nursing homes, assisted living facilities. Our strategy has produced many great successes and partnerships. Beginning at the end of February, our public health laboratories began running the CDC-approved tests. We are among the first public health laboratories in the nation to do so. Very early on, we surged to 2 shifts per lab with 7 days a week operation. On March 11th, we prohibited visitors from going to long-term care facilities to protect the most vulnerable. We launched our dashboard on March 13th, 2020, which we found on www.floridahealth.gov. And we really want to recognize our team for this incredible website. And actually yesterday, Dr. Birx of the White House COVID-19 Task Force recognized this nationally. We have partnered with schools of public health in our state, rostering more than 100 epidemiologists to help with contact tracing. And again, we've had community partnerships in many areas, working with faith-based organizations and universities. Where are we? As of this morning, we've tested 266,000 individuals. We've identified more than 26,000 individuals with COVID-19. Slightly more than 3,800 individuals have been hospitalized. There have been 789 individuals who've lost their lives to COVID. And overall, our positivity of the individuals who are tested is about 10%. How do we compare it to other states? In terms of testing, New York has tested 617,000 individuals, California 280, and we are at 266. In terms of cases per 100,000 individuals, the state of Florida ranks about 20th among states, and in terms of loss of life per 100,000, we're about 21. In terms of trends, we are seeing stabilization in terms of numbers of new cases per day, and also in terms of hospitalizations. We've been relatively stable for more than a week now, with about 2,000 individuals in the hospital each day, and in terms of those individuals in intensive cares and ventilators. We are continuing to follow our trends and react, and we do so using evidence-based approaches. We are expanding our testing, continuing to use data to drive our responses, enhancing our community partnerships, and keeping Florida informed. And again, look forward very much to working with you in this very important endeavor.
That's fantastic. Thank you, Dr. Rifkes. And now we have our Secretary, Mary Mayhew of ACA, and she's going to be talking about hospital capacity, current provider statistics, and other things. Secretary?
Thank you, Shane. And I also want to express my appreciation to the Governor and Lieutenant Governor for their leadership, for the opportunity to serve alongside this team here, Dr. Rifkes, Director Moskowitz. This truly has been a multi-agency team effort. When I think about where we were 50-plus days ago, the level, we've all used the term unprecedented, no playbook, and I think what has been most challenging, the ever-changing federal guidance throughout this process. Certainly where we began with the concerns about limited access to personal protective equipment. But where we are today is a testament to the decisive leadership, the swift execution of decisions, clear, consistent, and frequent communication. I know that Dr. Rifkes and I he's probably done more, but I know at least over 80 statewide calls in the last 50 days to healthcare providers, long-term care providers, behavioral health providers, and those were forums to clearly communicate critical guidance. Effective leveraging of Florida's emergency preparedness, and importantly, our laser beam focus on our mission of protecting the elderly and medically vulnerable. We have had the benefit of strong state-level coordination with regional partnerships, clear prioritization of deliverables, And as both the Surgeon General and Director Moskowitz have said, data-informed decision-making, and I would add, a team that has been always accessible. I want to focus on briefly what we have done to protect our elderly, how we have worked to prepare for the surge, and our efforts, particularly through the Agency for Healthcare Administration, on preserving access to critical care. As a reminder, Florida, for our efforts in serving the elderly, we have over 700 nursing homes, over 3,000 assisted living facilities, serving over 160,000 individuals in Florida. Our efforts to date have been focused on standing guard at the doorway of those facilities. What we began in the early days of March was focused on the level of infection prevention and control needed to combat this virus, and that it frankly exceeded the level of infection prevention typically associated with our nursing homes and assisted living facilities. I say that because of the monumental effort that had to occur over the last several weeks, and again, in an ever-changing landscape with regard to federal guidance. So our efforts have been consistently focused on clear communications with our long-term care providers. The Agency for Healthcare Administration conducted over 1,300 on-site visits. We have made over 11,000 calls focused on infection prevention and control. We have been consistently a partner with the State Department of Health and county health departments. And as we think about where we are today and moving forward, it's critically important to acknowledge the strong partnerships that have been built upon and strengthened through this crisis. Any crisis, any emergency, there are obviously challenges around our efforts to remain focused, to be proactive, but to build upon the accomplishments. And truly, the level of relationships and coordination between the state and local level are stronger than they ever have been. And through our efforts, we have focused on making sure, as everyone has described, that we were preventing the virus from coming into these facilities. We have also, and I want to stress too, that when you shut down visitation in a nursing home, we all understand how critically important those family connections are, the visitor connections are, and how disruptive this has been to life in a nursing home and assisted living facility. We've not only shut down all of that visitation, but all of the activities, the congregate activities, the congregate meals, because of the risk to that population. But important to understand how challenging that has been and how disruptive to the lives of those in those facilities. But we have truly been successful in combating this virus, working closely with our long-term care providers, prioritizing the training. We've also worked to improve their flexibility around their workforce. We made sure to expedite training programs for personal care attendants to be able to serve and provide services associated with CNAs. We have provided additional flexibilities to ensure that they've been able to meet the increased need for their workforce required to screen. We've also understood the financial pressures and recently delayed payment of a quality assessment by nursing homes and intermediate care facilities because of the cash flow strain that the increased cost of supplies and staffing has had on these organizations. We also worked closely with our hospital, our community hospitals, to support a strong collaboration between skilled nursing facilities, assisted living facilities, and their hospital partners so that we could have clear communication around transfer protocols as individuals were hospitalized and needed to return to their nursing home or to their assisted living facility. With regard to preparing for the surge, I just want to really underscore how important our emergency status system is and what it has provided throughout this process. This is a system that we use during emergencies to monitor bed capacity. Throughout the last 50 days, we've continued to strengthen that system in order to give us increased data and reporting, not only on bed capacity, but also related to the rate of hospitalizations, the PPE needs of hospitals. And I think, again, what has been a testament to the value of this system is that the Federal Emergency Management Agency recognized that this system was adequate to meet the federal reporting requirements for all hospitals, so that hospitals would not have additional administrative burden. As we've gone through our surge preparedness, we have worked closely with individual hospitals and with regional groups of hospitals. I want to commend all of the hospitals throughout the state. The level of regional collaboration, transparency, and data sharing has helped to inform our regional preparedness. As we focused in on determining the number of beds available for surge, we really have driven down to a level of awareness that prepares Florida well now as we move into our next phase, but to be always at the ready in terms of the capacity of our hospitals and of our regions to respond to the next crisis. There are today identified over 30,000 beds that could be used if we were to see some significant surge. There are over 6,000 ventilators that could be available based upon current capacity. We have worked with the hospitals on rooms that they would convert for ICU status, anesthesia machines that they have inventory to determine the ability to convert those machines. And of course, as we know, hospitals dramatically rolled back procedures and services through the governor's executive order related to electives. That has created incredible capacity within the system, but certainly it has come at a consequence to the financial stability of our hospitals as well. And that has been certainly front and center for the governor and for all of us as we move toward this next phase. I also want to speak briefly to the work that we have done to ensure the continuity of care. There's no doubt that we have seen major disruption in access to medical services, behavioral health services, substance use disorder services, services that have been provided in adult day programs or in individuals' homes. And through our Agency for Healthcare Administration, we have worked to provide a level of flexibility around the providers and their ability to provide those services through telehealth, through telephonic services. We have provided flexibility so that services could be more conveniently provided in individuals' homes. That has been a critical focus of ours as well, that while all of the executive orders were put in place, that we did not lose sight of all our vulnerable throughout the continuum of care to make sure that there were no gaps in access to services while we work to prevent the spread of this deadly virus. So again, I want to express my incredible appreciation for the frontline staff that have worked tirelessly, dedicated and committed to battling in this public health emergency, to fight this virus, to work closely with the state, with their regional partners. It truly is a testament to Florida's leadership in terms of where we are today and what this task force has at its disposal for data and information and lessons learned to help guide us into this next phase and into our statewide recovery. Thank you very much.
Oh, thank you, Secretary Mayhew. All right, as we get close to the close, I have an opportunity now to walk everybody through what the working groups and the calendars are going to look like. But before I do that, I know that the governor wanted to just say a special thank you to everybody.
Yeah, well, one, just thank you guys for your willingness to help serve Florida. And I particularly want to thank our executive committee members. We have our Lieutenant Governor, Jeanette Diaz. We have our Chief Financial Officer, Jimmy Petronis, our Attorney General, Ashley Moody, Senate President Bill Galvano, Speaker Jose Oliva, incoming Senate President Wilton Simpson, incoming Speaker Chris Sproul, Education Commissioner Richard Corcoran, Jamal Sal from Enterprise Florida, Miami-Dade Mayor Carlos Jimenez, Broward Mayor Dale Holness, Palm Beach Mayor David Kerner. Then we have folks from the private sector. We got Josh DeMauro from Disney. We got John Sproul from Universal Resort, Joe York, AT&T, Eric Salaji, Florida Power and Light, John Corus, Tampa General, Alex Sanchez, Florida Bankers, Paul Riley, Raymond James, Patrick Sunderland, Lockheed Martin, Todd Jones, Public, and Sid Kitson from the Board of Governors for the State University System. So to our executive committee members, thank you for being willing to take a leadership role in this. And for all our committee members, I want to thank you again for your concern for Florida and your commitment to getting us, not only back on our feet, but resurging back to where we all want to be. And with that, Chief of Staff Shane Strum is going to give us some next steps.
All right, fantastic. Thank you, Governor. So we're going to continue to talk about the mission of the task force, and we're going to discuss the important considerations of what major industries of Florida we are going to develop and how we're going to reopen. You heard the Governor talk about the executive committee members. You'll also be hearing a lot more later today and tomorrow regarding the rest of the rollout for a reopened Florida on task force members. And we want to thank all those that have volunteered and those that have been selected to serve. You're going to be tested and working a lot. It's going to be not an easy task or mission, but you're going to be receiving a lot of help from us. So I just want to make sure that everyone knows that we'll be there. And just to kind of share, the Governor's Office of Policy and Budget will oversee the staff work on this task force for the next week or more, how long it takes. Your point of contact is going to be the Governor's Director of Policy. That's Chris Spencer. There are going to be many working groups, but the first 3 of the working groups that will meet on a daily basis at 10 a.m. will actually begin tomorrow morning, Tuesday, April 21st. The working groups are going to be divided up by the high, medium, and low-risk industries we discussed during today's presentation. Originally, there were a lot of thoughts on making sure that we included everybody. We wanted to make sure that there was no industry or sector in the state of Florida that was overlooked. We have a very large, broad list of folks. And with the Chamber's help and others, we were able to break it down into that low, medium, and high. And those folks will be in those industries that we believe can kind of get up and out quickly. There will be some overlap between the executive committee members of the task force and the working groups. Again, the staff at the Office of Policy and Budget will prepare a summary of each working group's discussions every day and distribute those to the executive committee prior to your meetings. The executive committee will meet daily at 2 p.m. to recap on those discussions of the working group and the calls that they had throughout the morning. The final meeting of the executive committee will occur on Friday, April 24th at 2 p.m. unless additional time is required or needed. After this meeting, the Office of Policy and Budget will compile the discussions and recommendations of this task force, and then they will brief the Governor on the strategy to reopen Florida. So if you have any additional questions, I'm always available. That's Jane Strum, and then also Chris Spencer, the Director of the Office of Policy. We're also going to have Adrian Lucas, who has been running point on COVID-19 for the Governor's Office. So you have all of us, and you've heard from our 3 agency heads today, really stepped up in this time. They've been working really relentlessly and tirelessly and burning the candle at both ends, but we can't thank all the staff at the agencies for all that they're doing. There are so many people working on a daily basis to make sure that things are going as well and as smoothly as they can be. So we want to thank our private sector, our public sector. We also want to thank the members of the House and Senate. They've been especially helpful in this time. They receive a tremendous amount of phone calls, really ranging on every topic you could think of they're being called on, and they've done a wonderful job of reaching out to the constituents and making sure that they weave us in on those areas of concern or areas that we can be helping. So as a member of the task force, you'll be receiving even more calls from members of the public and other people that are going to be looking for your insight and your help. They're also going to want to provide you recommendations. We would ask that you listen to any and everybody that provides any type of recommendation, because so far we've already heard so many on just what does a reopening look like. And we'll give you just a basic example of restaurants. So we've had a lot of phone calls, and people believe that we can start to do those openings soon. We're not sure how soon, but that'll be the recommendations of these committee members. The thought is, do you start with opening outside dining again? Do you look at doing 25 or 50% of restaurant occupancy? And if you do that, you still have to continue to do social distancing, but you can't just have everyone show up. So the thought would be if it's 25 or 50% of occupancy, we would require reservations. But those are just some of the things that you're going to learn. You heard the governor talk about the businesses and what their thoughts and plan are. Another big one is healthcare. You're going to see a lot from the healthcare folks. Secretary Mayhew and Surgeon General Rifki's here a lot, especially on elective surgeries. People would like to begin those immediately. One of the major critical concerns is the shortage of PPEs throughout the state of Florida. Director Moskowitz has worked diligently to make sure that we have those supplies, and we've been able to keep those on hand. His shop is actually open 24/7, so as soon as they're able to secure these supplies, they're immediately sent out. We are not keeping anything on hand, so whether they're the swabs, the test kits, you name it, the PPEs and all the other things that Director Moskowitz mentioned earlier today, we buy them as quickly as we can. You probably hear from folks that tell you they have a vendor or someone out there. If you send them to Director Moskowitz's shop, they'll make sure that you have those. And if you have questions, regulatory or anything on health or the Agency for Healthcare Administration, Secretary Mayhew and Surgeon General Rifki's are here. We know another issue has been the Department of Economic Opportunity. That's a big issue. That's actually Secretary Satter has stepped in, and he'll also be helping there. So if there are questions that you'd like to discuss with us online or offline, we're going to make ourselves available to you anytime, any day. So one, just thank you again for all those who will be serving and for what you're being asked to do, and we'll look forward to working with you. This time we were going to open it up for just a few last brief questions or comments. So at this time, the line is open.
Shane, hey, it's Jimmy Petronas. Governor, thank you for your leadership on all this. I just wanted to take a second to praise Shane a second. This guy's been through the last economic downturn we had. He went through the oil spill recovery. You got a steady hand there kind of running point internally, and look forward to working with you, especially as we try to find a way to find 127 million new tourists to find the confidence to come back and patronize our state. But I'm convinced with the group you have here and the leadership of your office, we'll work toward that and making whatever necessary changes moving forward that we are fiscally responsive to our citizens, taxpayers' needs, and you know, this is one of a kind enemy we've never seen before. So thank you for your leadership, and look forward to helping out.
Thank you for your kind words, CFO Petronas. We've been through a lot of battles together, and we've really done a lot for the state of Florida. We're going to continue working together. Thank you. Any other questions?
Hey, Shane, Sid Kitson. Also want to thank the governor for bringing us together. Thank you for all your work. We understand the magnitude and the responsibility of the decisions that need to be made here. We all do. As it relates to the university system, we have many of the best scientific and medical minds in the world, and we plan to use them to help formulate a plan that will help keep our students, our faculty, our administrators, and support teams safe, but at the same time provide a world-class education for our students. So there's a lot of work to be done, and look forward to moving forward.
Well, thank you very much, Sid. And that's Sid Kitson, Chairman of the Board. You know, one thing I'll say just in between is we really want to make sure we stress the importance of considering the updates from the call today, you know, to really set the baseline for discussion of the upcoming week, and that you'll have Dr. Parrish and Mark Wilson to be able to help us also with that.
Shane, this is Shane, Carlos Jimenez from Miami-Dade. I want to thank you, the governor, and the lieutenant governor for all your leadership, and I'm very proud to serve on this committee and start us up again. We're doing a very similar process down here in Miami-Dade, and hopefully we can bring whatever we learned down here about starting our economy to the rest of the state. And I look forward to working with all of you. One thing that I would want to say is that we have done some of this testing in the community, and 60% of the people that we found in the first round of testing that were positive had no idea that they had the COVID-19, had no symptoms whatsoever. So it's a very, very interesting and very strange virus. And again, I think that this is a long-term issue until we get a vaccine, and I look forward to opening up our economy because we need to get Florida moving again.
Well, thank you, Mayor, for all you've been doing. Coming from the largest county, you have absolutely had your plate full. But I know you and the governor talk on a daily basis, and we can't thank you enough for your leadership.
Oh, thank you,
All right.
guys.
Any other
You guys have been
comments?
great.
No, thank you. Any other comments? All right. Well, not seeing anything else, we thank. I think I hear one last one. Nope, maybe it was just a ruffling of papers. All right. Well, we want to thank everybody for joining the call today, and we'll look forward to speaking and seeing you soon. All the best.
Thank you.
Thank you. Thank you.